Hello, everyone, and welcome to another episode of the MedCity Pivot Podcast. Today, I'm chatting with an exciting startup based in Minneapolis, which is called CoraVie Medical. CoraVie actually won one of MedCity's Pitch Perfect contests at our Invest event in Chicago in 2024, and I actually had the pleasure of writing the profile piece on this startup after they won the competition. So I know a little bit from its CEO, Aimee, about how they're looking to transform, blood pressure monitoring treatment. So I can't wait to get into it for this episode. I'm going to start off by having Aimee and our other guest, Dr. Michael Bloch, introduce themselves. So Aimee, I'll hand it over to you.
Great. Thank you so much, Katie and MedCity, for allowing us to do this podcast. Really excited to share more about what we're doing. I am a 30-year medtech veteran, electrical engineer with an MBA, and just love being in this industry. I spent at least 8 years working with physicians and patients and getting to see the work that Dr. Bloch does every day and seeing where the challenges and unmet needs are. And we're just really excited about making an impact and making a difference with CoraVie Medical when it comes to blood pressure and hypertension management. And I was so fortunate to get introduced to Dr. Bloch through one of our physician advisors. And he said, he is the person to know when it comes to hypertension management and preventative cardiology. And so we're really excited when I got a chance to meet him and learn more about him and his practice and what he's all about.
That's really nice. So my name is Dr. Michael Bloch, as you heard. I'm a hypertension and vascular medicine specialist in Reno, Nevada. I've been running a difficult to control hypertension center out here for better part of 3 decades. And I've been very, very interested in the management of hypertension. We spend a lot of time in hypertension talking about what our tools are to lower blood pressure, not nearly enough time thinking about how we measure blood pressure. And so that's been, really one of my passions. And Aimee's technology really has bubbled up to the surface over the last couple of years as being something that's got a lot of potential. And so I was delighted to come on as an advisor and to see where this technology is going to take us.
Awesome. Well, thank you both for that introduction. And it really seems to me like CoraVie wants to change the way that blood pressure is monitored through its implantable monitor. And I guess I didn't realize how stagnant the monitoring and measurement of blood pressure had been, because when I talked to you last year, Aimee, you told me that the fundamental approach to, hypertension monitoring hadn't changed in over a century. So I'm wondering if you can both talk about, the need for innovation in this space, as well as what a big market opportunity there is. And maybe, Dr. Bloch, we can start with you by covering, the current status quo.
Sure. Yeah, there's not been a lot new in hypertension, both in monitoring or even in treatment for many years. We finally are just having these new treatments that are becoming available. And in terms of monitoring, we pretty much take blood pressure the same way we do now as we did when I came to Reno, Nevada in the year 2000. High blood pressure is the leading modifiable risk factor worldwide for cardiovascular events like stroke and heart attack, things that actually make a difference in patients' lives. And we have great tools to treat blood pressure, but we have to know what it is. And one of my mentors, I'll paraphrase him a bit, but he always said it's the most important variable, that is blood pressure, is the most important variable that we obtain with the least amount of precision. So there's real limitations to how we measure blood pressure. Blood pressure, changes a ton from minute to minute and day to day. The purpose of blood pressure is to perfuse all our organs. And so it has to change from minute to minute and day to day, depending on the environment and the stresses on the organism. One of those stresses is going to the doctor's office. And so that traditional way of measuring blood pressure just a couple of times a year in a provider's office simply doesn't give us enough information to make clinical decisions upon. And there is this added issue of the stress of being in the doctor's office. We sometimes call this the white coat effect, where people's blood pressure is higher in the office than it is outside of the office where they live, sometimes markedly so.
Yeah, I love what you just said there, Dr. Bloch, because it's so true. There's so many factors, and I almost feel like they're, not on purpose, but really a desensitization to blood pressure. And it's just the way that we've done this for so long, and people just kind of live with it. But it's exactly like you said, it is the most powerful and prevalent cause in stroke, as one example. And when I think about what we're doing, I often think back to the patient stories. I have a good friend of mine, Paul, who was telling me about his mother-in-law, Linda, and she had just retired from a long career as an English teacher. And the whole family was together, and they were waiting for mom to get to the table. And so Paul got up to look for her, and he found her on the floor in the bathroom. 911, and time later, she suffered a massive stroke due to uncontrolled blood pressure. And it left her, really largely confined to her home, put a major stress on her family, and really put an abrupt halt to a lot of her plans in retirement. And it's stories like that that drive me to try to do something different. And that's where a lot of the innovation comes for CoraVie. I like to think of us, I've been saying this lately, as the CGM of hypertension. Continuous glucose monitoring back in the day really was like the same sort of thing where people said, well, we can do a finger stick and a finger stick a few hours later, and we can draw a straight line between, and we know how to treat that. We don't need continuous. But once we got continuous measurements, we started to realize how much better we could do in caring for the patients. So similarly here with CoraVie, we have this huge opportunity to change the trajectory of how we monitor blood pressure. Because if you can't measure it, you can't manage it. And we're on a track to do that, which we're pretty excited about.
Yeah, I definitely see why innovators like yourself would want to create a device that could solve this problem. So I'd love for you to kind of walk the audience more through what it looks like for a patient to use this device, from the implantation process in the office to just day-to-day use, how long it could last. Amy.
Yeah, well, let me start by just throwing out a few things here. So for anyone out there in the audience who has hypertension, who deals with this challenge and has been told to measure their blood pressure at least twice a day, CoraVie Medical eliminates that need. There is no need to measure twice a day. There is no need to remember to measure. There is no need to record a diary. There is no need to make sure you do the measurement correctly. There are no wires. There is no worry about, can I shower, can I swim and still get my blood pressure. It's complete, automatic, effortless peace of mind from a patient perspective. And as we've been out talking to patients, they really value that automaticity and just effortlessness of the blood pressure just happening, because it is largely an asymptomatic disease. When it comes to the, oh yeah, go
Well, I was
ahead,
going to
Dr.
say the other, tremendous advantage is the ability to get blood pressures at night. It turns out that blood pressures at night while you're sleeping are even more predictive of cardiovascular risk than those during the day. So having a technology that is able to capture those and able to capture just large quantities of data throughout the patient's different life experiences is just incredibly important.
Yeah, that's a really great point as well, because we're just, from talking to you, Dr. Bloch, and talking to other physicians, and seeing the interest and desire to get that nocturnal blood pressure, which is really not viable through many of the options that exist today. So, just to comment on the procedure side of it, because I know that is a hurdle that a lot of people think about. Well, yeah, this is an invasive procedure. When you think about someone who's just had a stroke, thank goodness they're alive. They may have a long road to recovery and they want to prevent a second stroke, right? If your doctor tells you this is the solution for you, that we need to ensure this doesn't happen again and to make sure that you're monitored so we can get you the best care, we believe that that threshold for getting this procedure makes complete sense. And with that said, I mean, we're talking about a very simple procedure. Can be an office outpatient procedure in a matter of minutes. You could imagine something that comes preloaded in your pen, in a pen-like device. You just numb the tissue and insert under the skin. Maybe it's just a steri strip over the top of it. So it's really a modest lift for the significant benefit for the patient.
Yeah, that's awesome. I mean, it's certainly you can see what a big difference it is from just that little snapshot in the office to, a person living their whole life, all the ups and downs that could involve, through the course of days, weeks, years even. So if this were available today, if this were, available via the in-office implantation procedures right now, how might physicians integrate it into their practice? What would that look like, and how might it change the way that they practice, or how might it benefit their patients? I know there's also the potential for this to be, a companion diagnostic for things like renal renal dener I can never say that one, but renal denervation.
Denervation. Yeah.
So yeah, Dr. Bloch, if you could start us off with showing what it might look like in practice.
Sure, sure. I think, it's important to think a little bit about the alternatives that we have currently before we think about how to use it in practice. I make great use of technology called 24-hour blood pressure monitoring. It's really sort of the gold standard of knowing what your blood pressure is. It's a big cuff that you wear around for 24 hours that inflates every 20 minutes a day and once an hour at night. And it solves a lot of the problems that we talked about. You get more data across a wide range of environmental stresses. You get nighttime readings, but it's inconvenient and it's not widely available. And patients don't want to do it over and over again, day after day, right? It's something you maybe are going to do once every year or two. There's also home devices. There are fairly inexpensive devices that patients can measure their blood pressure at home by themselves that are relatively accurate. But it's really hard to get that data to my desk in a way that I know that it's been taken in an accurate way, that I have the full range of readings, and that I can then integrate into a treatment decision. There are some strategies that are out there that we call remote patient monitoring, where we try to do that. But it's really limited with those available technologies. And a lot of patients get anxious when they take their blood pressure and their blood pressure goes up. They don't take it often enough. Some patients take it too often. So something that could just collect and aggregate that data and transmit it to me in a usable fashion, where I'm really interested in what's their average blood pressure, like what's the mean blood pressure, because that's what's related to risk, not what the highs are, not what the lows are, but what's that average blood pressure during most days, during most nights. And then I can make treatment decisions. Are you on too many medicines? Are you on not enough medicine? And I think that too many medicines is a really important use case, that I think there's a lot of people who are actually over medicating based on their office readings, and their blood pressure really isn't as bad as we think it is. And sometimes when we really do get true out of office blood pressures that I can trust, we can de-escalate their medication strategy. And you mentioned, renal denervation, and I think it's also an important use case to start thinking about what we're going to be doing in the future for difficult to control high blood pressure. There's a whole category of people that we consider resistant hypertensives, people who we can't seem to get down with our traditional medications, which have been relatively inexpensive. But there is a whole host of new technologies that are coming on board. There's devices like renal denervation. There's some new, very expensive, but very effective medications that are coming online. And I think, as we start to think about how we're going to integrate these things, I want to know what somebody's blood pressure is before I put a catheter in their kidneys and apply a bunch of energy across that renal artery and denervate their nerves. I don't want to do it if their blood pressure is actually okay. So I think, being able to accurately assess what somebody's blood pressure is really important. I also think that patients are going to be able to make more changes to their own lifestyle and maybe to adherence if they know what their blood pressure is. The analogy that Aimee brought up with continuous glucose monitoring, I think is a great one. When we first came out with CDMs, we really thought they'd be mostly used by people who have really difficult to control diabetes. But it turns out that a lot of people really like to use them if they only have mild or moderate or easy to control diabetes, because they really want to see the effect of different foods, different exercise habits on what happens to their sugars. And this technology will allow us to do the same thing with our blood pressure. I tell my patients not to go out and have salty Chinese food because it's going to increase their blood pressure. For them to actually see that and see that their blood pressure is elevated the next day will really allow people to start making the lifestyle changes, start taking their medicines as prescribed, and really become more motivated and integrated into their own care. So I think it really does a nice job of closing that loop between the patient's home, the doctor's office, and a monitor where we can see exactly what's going on.
Yeah, I absolutely love how you describe that because, you know, when I think about blood pressure, when I've talked to people, it is largely asymptomatic. So I think of the typical, okay, my pants are getting a little bit tighter, my belt, I have to go one belt loop lighter. I know maybe I should step on the scale and see what's happening, and maybe I should try something different to lower my weight. But that doesn't happen as much in blood pressure and hypertension. And so we have this opportunity to provide that sort of insights back to the patient. And I'll tell you, this is an area where I'm really excited about AI and artificial intelligence. And I know everybody's on this bandwagon about artificial intelligence, and it has this amazing power which can be used in a positive way if we think about it. And this is one area where you think about an individual, and we can create a system that connects to that individual and their family and loved ones and caregivers in a way that is personalized, customized for that individual to say, hey, you should do XYZ differently, that will maybe motivate them to do something different. Maybe it will motivate them to, maybe I will take my hypertension medications today, or maybe I will not have that salty Chinese meal today because I know these things about myself. So we're really excited about that potential as well.
Yeah, that's excellent. And I wanted to also point out something I noticed in the CGM analogy, which is that, a lot of the CGMs, they started off just purely monitoring blood glucose. And now there's a lot that integrate with the insulin pump. So it's, a closed loop system of monitoring and treatment. I'm wondering if in the future there's ever a possibility for CoraVie's device to kind of deliver a similar closed loop system like that.
Yeah. Go ahead,
I
Dr.
was going
Bloch.
to say, I think there definitely is. The maintenance of blood pressure tends to be with medications that are much longer acting than insulin. So I'm not sure that we're going to have a, hour to hour change in our blood pressure medications based on somebody's readings. But week to week, month to month, year to year, absolutely. I mean, I tell a patient that they need to, if they lose some weight, their blood pressure is going to be easier to control. And I make them a follow-up appointment to see me in 6 months. That patient loses weight over the next couple of months, I have no way of knowing if their blood pressure is decreased till they come back to the office. But if we have a closed loop where I'm getting a data dumped to me at any time, we can either have somebody on my office staff make those adjustments to their medication, or you can even get to the point where you can do that on a systems-based approach, either where there's just a note to the pharmacy to cut back on some of their medicines, or a note to the patient. But we can really quicken that loop. Currently, it takes about 2 years on average. Once we diagnose somebody with high blood pressure, it takes 2 years before we get them under control. Those are the people we get under control. 50% of people we never even get under control. But we can really tighten that, and that's years of uncontrolled blood pressure that they're exposed to cardiovascular risk. We can really tighten up that loop if we can get data on, what's going on after we've started a medicine, or patients may change their lifestyle. That can happen before a patient comes back to the office.
Yeah, this is so cool. And I, of course, being an innovator and loving and being in this medical device space for so long, I think about neurostimulators and how neurostimulators are becoming included and involved in so much therapy. And CoraVie Medical is so well positioned to be integrated into another implantable neurostimulator type technology that you could imagine, down the road, where you can create this closed loop where you don't need to be stimulating all the time for whatever hypertension therapy it is, but you can monitor pressure and know when you need to stimulate to lower. And we see that as a pretty exciting thing. We're aware of some different neurostimulators that are seeing an impact on blood pressure, or a response to blood pressure. And if they had the closed loop, the continuous monitor that could help them know, hey, let's do this stim, because we need it right now. That's something that's kind of exciting also to think about.
I also wanted to make sure that I'm pointing out that, there's a difference between a wearable blood pressure monitor and an implantable one. And there is a lot of activity in the wearable blood pressure monitoring space. But CoraVie took a different route. And I think it's worth asking, why you took that route, the implantable device route.
Uh, I'll make a couple comments, but I would love Dr. Bloch to kind of share his perspective on this as well. I think first and foremost, when I think back to my earlier medical device experience, I wrote a lot of business plans, business cases for new products and technologies. And one of those was for an insertable cardiac monitor for arrhythmias. So somebody's fainting, their heart, you want to know, is their heart rate fast or slow? Is it due to their heart or not? And at the time, there were all sorts of wearable technologies for arrhythmia monitoring. And everybody knows now Apple Watch. Apple Watch is monitoring for atrial fibrillation. Yet we came out with a strategy to come up with an implantable device that could be done in an office-based setting. And it turned out to be one of the fastest growing products in the company's history. It's over $1 billion market today. And it's so relevant because CoraVie Medical is leveraging that same playbook here. And there's so many similarities and analogies. And what an implant provides that a wearable technology can't, if we let's just exclude the accuracy for a moment and just talk about the other piece that we've been explaining, nighttime blood pressure, patients' anxiety associated with measuring their blood pressure, all of these things, patient compliance overall to blood pressure monitoring. These are major problems that are 100% eliminated when you have a device inserted under the skin that's automatically doing these things. So in one sense, we take the patient out of the equation and all the factors with the patient that can cause a challenge. But I would love to hear Dr. Bloch's thoughts on what, because there's so much excitement and hype around that. And it's not that it's this or that. I think there's a space for each technology and they meet different needs.
Yeah, two things. I think that's a perfect explanation. A couple things I just emphasize is the first you said, let's just leave accuracy aside. Well, that's a big problem with wearables is accuracy, and especially with our current state of those technologies. The makers of those technologies are very quick to say that no one should be basing their medical decisions on this. It's not a medical device. I do think it's a great device for potentially diagnosing high blood pressure in certain people, for getting a rough idea of where their blood pressure is. And I think there's certainly a role for wearables in some of the patients who are at less cardiovascular risk and where you just sort of want, in broad strokes, to know what's happening with their blood pressure. But when I want to make life or death medical decisions on somebody, if I want to do, put a neurostimulator in, do renal denervation, use expensive medications, consider a third or a fourth medicine, or even consider backing off on medications, I want to know that what I'm using is accurate, and not just accurate in a healthy person, like many of the wearables have been studied in, but accurate in the wide, what we call phenotypes of people who have high blood pressure. So they look very different than people who tend to wear wearables. Many of these patients are sedentary. Many of these patients are overweight. Many of these patients have already had heart attack, stroke, and having accuracy across that patient population is just not there or going to be there with most of our wearables anytime soon. And part of it is technological. I don't know how much Aimee wants to share about her technologies compared to them. There's definitely a technological advantage in terms of accuracy. But I think just in terms of just the concept, wearables are great, and they can give alert patients they need to get in to see a provider because they don't like what the watch says about their blood pressure, but I'm probably, at least in the near time, in the short term, not going to be making medical decisions based on the the numbers that I see on that wearable.
Well, we don't have a ton of time left, but I'd love for us to end our conversation by a look to the future. I would love to know what is next for CoraVie in terms of, I'm assuming, clinical studies, possible FDA submission, or maybe an expected commercialization timeline. Aimee, do you have any details to share?
I can share some high level. I mean, we just completed some amazing animal studies that show statistically powered, highly accurate, repeatable, robust blood pressure measurements. And we're on track to get our product concept complete so that we can move into human feasibility and get to exactly what Dr. Bloch is talking about, testing in those patient populations where this will be used that don't have perfect arteries but have diseased arteries, and how well does our device perform in that setting. We see a path. I should comment that, early on we were awarded FDA breakthrough device designation, which means that the FDA sees our technology and innovation as an opportunity to help so many patients. It's innovative technology that can really make an impact and a difference. So, we're on track to, be in the market in about 4 years. And we're really like moving as fast as we can to get to that point, and excited to be able to impact all the patients one by one that could benefit from our technology.
Well, definitely an exciting next few years for CoraVie, and that's really exciting to hear. And yeah, we just wish you continued success on this journey. And Aimee and Dr. Bloch, thank you both so much for your time today. It was great having you on.
Thank you, Katie. Really appreciate the time.
Thanks
Thank you,
much.
Dr. Black.